Okay, I mentioned about chest shape. You got bell and barrel. So bell is the what most people are. That means you got the shorter upper diameter compared to the lower part of the chest, which is longer. So that's bell. Whereas when barrel, then the upper diameter here and the lower diameter here is the same. The upper diameter here and the lower diameter here is about the same length. So this is bell and barrel. Can one breast be bigger than the other? Well, the answer is yes. Both sides should be symmetrical, right? But if they are unequal, it can simply be because of rotation, or could be a normal variant, could be also unilateral gynecomastia, or there could be a mass, a lump inside that breast. So be aware of this thing. In this case, in the radiograph that I'm showing here, this is simply due to rotation. So you like to actually ask for a repeat chest X-ray. This is not acceptable. Okay, having done that, then the next step is to look at specific areas, starting with the mediastinum. This is the whole thing here in the middle here is called a mediastinum, and then look at the right lung, and then look at the left lung. And when you're looking at the lung field, look at go by zone. Look at the upper zone, look at the middle zone, and look at the lower zone. How do we determine the zone? We take the anterior rib, the first and the second. This is the anterior end of the second rib. So anything above here, that's the upper zone. Between the second and the fourth, just draw another line. Anything here will be the middle zone. Anything below the fourth rib, anterior fourth rib, will be the lower zone. Then look at the four hidden areas. What are the hidden areas? The epiphysis, the apex here, the epiphysis. Then the hilum, the right and left hilum, and then the cardiophrenic angle, and that means the angle between the heart and the diaphragm, the cardiophrenic angle. Same thing on right and left, and then the costophrenic angle, that means between the chest wall and the diaphragm. So that's the four hidden areas. Why do we do this? Because what we have, after we have had a big look at it, and then look at the lung field, the mediastinum and lung field, then go back and look surgically in these areas so that we do not miss any pathology. If you do not go in and see again, although it's staring at you, we can easily miss it. Finally, what I do is I look at the outside the lung field. I do this, I mentally block my vision and look just outside the chest wall, if there is anything in the soft tissue, anything that I could have missed, or I could sometimes physically, I put a piece of paper in the middle so that it doesn't distract me. Then I look around again. So that's what I do. Basically, how I read my chest X-ray will be starting with the big picture, then the mediastinum, the right lung, the left lung, both epiphyses, the hilar region, the cardiophrenic angle, the costophrenic angle, then outside the lung field. And then finally, what I do, again, I have a second look to make sure that I do not miss any pathology. So this is in general how I do it. But when we come to, for example, looking for rib fractures, I'll explain in a more detail later how I read the chest X-ray when looking for rib fractures.